All right. So, hi, good evening, everyone. I hope I'm live. You all can see me and hear me very clearly. Can I have some thumbs up if you all are live and are able to see me? So, I'll just wait for a while so that people can respond and we can start. Okay. All right. Can I have some thumbs up? Okay. So, guys, this session is all about the exam analysis and mega recall for orthopedics. Hi, Rohini, Shivangi, how are you doing? So, Bacho, I'm very, very happy. Again, the FMG exam and the questions of orthopedics definitely were not that difficult if your basics were clear, if your mind was very, very clear without any negative thoughts, and definitely, right? So, questions would have been not that impossible type for any one of you. So, hi, Ishfaq, Danish, Dharan. So, hi, Dharan, how are you? Long time that you have been here. Okay, so now I'll just tell you about all the questions and see, I am very happy personally because I can found all like I was able to just see all these questions in my workbook only that we have been filling together in the class of orthopedics. So I've been very, very happy looking at the MCQs and let me show all the new students as well, those who are going to appear for the December exam, that how important it is to understand the basics and concept of a particular topic to solve the papers, right? Now, one important thing before I start my recall, the orthopedic part, is the message which this exam has given to all of us that there is no more a scope for one-liners. There is no more any scope for any kind of mugging up of the questions or the subject. There is no scope of leaving any subject. There is no scope of thinking that only the FMG PYTs are going to help. PYQs anyhow are not going to help, right? Only the PYTs of FMG are going to help because in this exam you had the PYTs of the INA set exam, right? So please do not underestimate the FMG exam anymore. Please read them in a very, very conceptual manner, starting from the scratch, from the basics. It is all about the medical science, and you are expected to know everything about everything. Is it so? Not really. So you are expected to know only something about everything, and that something actually has the basic and the concept, right? So now back to form. Okay, Dharan, my best wishes, dear, and I've been seeing you that you have been very, very consistent with all the live sessions. So my best wishes to you for your December preparation. So now I start with my session, and this is definitely something which I was personally very, very happy. Let me just share my happiness with you as well. So, Bachchan, this was your first question. In elderly women, there is some screen getting cut. Just give me a moment. Let me just adjust it. I don't know how to set it right. So let me just try once more image. I don't know. Uh, Parvinder ji, if you can help me, option 4 is not visible. If you can just please help me out. थोड़ा सा इसका अगर विंडो हम ठीक कर सकते हैं. So option 4 is getting cut. Parvinder ji, if you can help me, let me just try. बच्चों, just give me a moment. Let me just try. Okay, I can do this. Not happening. Okay, now I think it should work. Yeah, this is better. This is better. This is better. Much, much better. Right. Now, look at this very first question. And I'm very sure each one of you can easily answer this, right? Elderly women, elderly women involved in a RTA presents with difficulty in breathing and altered mental status. X-ray finding as suggestive. What is the most likely diagnosis? Right? Please tell me the answer for this. Everyone who is live with me. What should be the answer? Elderly women, elderly women after RTA, right? What is the fracture we are looking at? The fracture shaft of the femur, right? And what is the most commonest complication related to fracture shaft of femur in the first to third day of the injury? You know that very, very well, isn't it? Fracture shaft of femur, the marrow, and the fat globules, right? So that usually leads to fat embolism syndrome, right? And this fat embolism syndrome, what is the criteria we always learn? So let me share the fat embolism, the breathing difficulty, altered mental status, and GERD's criteria. The GERD's criteria, remember? In the GERD's criteria, we have got four major criteria. right? Four major criteria is decrease in the saturation of oxygen, right? Number two, when they are petechies in the waist distribution, then the CNS involvement or the respiratory system involvement, right? So out of these four, in this particular question, they have already mentioned, right? They have already mentioned the two, that CNS is involved as well as the respiratory system is involved, right? And this is the screenshot from your workbook, right? That is a screenshot of chapter number 12 of your workbook, that is fat embolism syndrome, which is seen after the fracture shaft of the femur and tibia, usually within first 24 to 72 hours, right? So in the question, they have given you two involvement, CNS and the respiratory system, right? CNS and the respiratory system, right? Now, next one. Okay, so I'm very, very sure each one of you can easily, right, make it out, right? Fat emboli, very good. Hi, Ishfaq. You are preparing for December session. This is my first chance. Beta, jam ke tayari karo, right? Jam ke tayari karo and make this first as your last, exam for the FMG. इसके बाद सीधा NEET की तैयारी, right? Not even NEET, INS set की तैयारी, right? So जम के तैयारी कर और इसी बार में निकालना है. So that is the first question, right? Second question you had, injury to which part causes difficulty in dorsiflexion of the foot? So they are talking to you about the movement of the foot. Now this recall, I'm not very sure whether they put about the question about the foot or the ankle region, right? Now in the knee area, we always discuss in our classroom, always discuss in the class that there is a nerve which is very closely, very close to the neck of the fibula. Which nerve is that? Which nerve is that? Very, very close to the neck of the fibula. And which nerve is that? That is common peroneal nerve. Now, if somebody's common peroneal nerve is affected, you know very well that what they are going to land up into. Common peroneal nerve injury leads to foot drop, right? So even the dorsiflexion, if I say of the foot, is being done by the peroneal nerve, the deeper part of the peroneal nerve. So if they mark this option B, the side B, right? A has been marked as the lower end or middle part of the femur somewhere. C has been marked the shaft of femur. D has been marked as lower condyle femur like that. And B option is at the neck of fibula. So you know very, very well, right? So you know very, very well that, yeah, you are on the chat option, everyone, right? Okay, so you know very, very well that it is the neck of fibula which involves the common peroneal nerve. And if common peroneal nerve is involved, it leads to usually foot drop, right? And this is the screenshot from your workbook itself, right? The page number 34 of your workbook. In the ankle injuries, you know very well that it is a mesoneal fracture we discussed, ankle fracture, proximal fibula fracture, and around the neck of the fibula. And we discussed even in the class that this is a very, 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 very important point for your MCQ. And this Q is your exam question, right? So common peroneal nerve, foot drop problem, and if there is a foot drop, how the patient walks, it's a high stepping gait, right? This workbook I'm showing you is from the Jan to June session class. Today it was first day of orthopedic class at our Delhi center as well, right? So see, understand, I always tell in my class and I'm telling here on the open platform as well. एग्जाम में कौन से क्वेश्चन सबसे ज्यादा आते हैं? एग्जाम में वही क्वेश्चन सबसे ज्यादा आते हैं जिनके पेशेंट्स आपके पास ओपीडी में सबसे ज्यादा आते हैं, right? So common things are asked more commonly, right? Common answers will be more commonly corrected in the exam, as simple as that, right? So ankle injury, it has been asked three times in the last year, both the INSET exam and the NEET exam, all the three papers, 24, right? And now this time it is your exam question. Okay, so common things are asked commonly, and that is why we always in our revision schedule, why we push all our students that you must go for INSET exam, why you must go for NEET exam recall, because we know now the level of exam for NEET, INSET or this FMG hardly matters. The language of the question is broadly same for all the papers. Questions are broadly same from all the three papers. They have the common topics from where questions are being asked, right? So common things are almost everywhere common in your all the three exams. This is your question number two. So all three are important: high stepping gait, foot drop, and all. Now question number three, very, very tricky one, and some people got confused here. And I want your opinion here. A two week old infant is brought to the hospital, right? And parents report a history of a single fall, right? Read the questions very, very carefully. What are the keywords? 2 week old infant is a keyword, right? Parents report a history of single fall is a keyword, but is a important keyword. But means they are trying to change your history to some other side. Other than that, if but was not there, it should have been if or so or something like that. But means now they are changing the history. So one single history of fall, but Reveals, X-ray reveals multiple fracture at different stage of healing. Another key word here. Fractures at different stage of healing. Now, in what all conditions, this is the topic we have covered today only in our classroom, right? What is the most likely diagnosis? So when somebody has multiple fracture, a child has multiple fracture, we have two differentials, osteogenesis imperfecta or battered baby syndrome, right? Osteogenesis imperfecta or Ranjan, how are you doing? Thank you so much for all the help, Ranjan. You have helped a lot, and you and your team have been amazing, right? So Ranjan has been our student from January to this June session, and she is a very, very hardworking and very, very focused, dedicated, child. And I'm very sure Ranjan, का result बहुत अच्छा आने वाला है. And now let's meet for the NEET PG preparation. Okay? So ऐसे बच्चे जो बार बार फ्रैक्चर के साथ आते हैं आपके पास, they have two differentials, OI and battered baby, right? But यहाँ why not OI? Why battered baby? Because the very first clue is not just this different stages of healing. Remember, parents are giving you only history of single time fall, but there are multiple fractures, right? Discrepancy in the history. So discrepancy in history means they are telling a lie. So if they're telling a lie, most likely answer goes in favor of battered baby syndrome. Most likely it goes in favor of battered baby syndrome. Okay, got the point here? So it is battered baby syndrome. And now see, this is your page number 15 of the workbook. So we discussed this case of osteogenesis imperfecta, and then we always discuss that if a child is coming to you with repeated fracture, then what is the most likely differential? Differences always battered baby syndrome. So in the osteogenesis imperfecta, most commonly involved long bone is femur, right? And in battered baby syndrome, most commonly involved long bone is humerus, right? So always remember, OI is a genetic defect, but battered baby is a abuse of the child, right? And you have to be very careful while selecting OI or while selecting battered baby, depending upon the false history, right? The different kind of history from different people. Okay. So this was another MCQ from your workbook itself. Now, another question. Patient was in a RTA. Patient had an RTA and presented with the following fracture. What type of fracture is this? Now, this is not a very difficult one. You all can easily recognize. Now, you all can easily make out. Now, this is the neck of the femur. This is definitely not a neck fracture. This is a greater trochanter. This is a split of the lesser trochanter. And you can see fracture line starting from here and there is a comminuted fracture. So this is not a very difficult one. This is the extracapsular fracture, right? Proximal femur. How we read proximal femur? Proximal femur is read as the injury inside the capsule and extracapsular, outside the capsule, right? So now when you look at this injury, definitely it is a IT injury, IT fracture. You all can make out easily. It is a IT fracture, and IT fractures are what kind of injuries? IT fractures are basically extracapsular. So from basic cervical fractures, rest everything is extracapsular, right? In this recently conducted INI-SET exam, there again there was a question on the IT fractures, and now the INI-SET exam question has been repeated in your FMGE exam. Now this is a recent example I'm just telling you, right? So when you are preparing with us, definitely, we always push you to make sure that you revise the NEET PG or INSET exam paper, which is a part of your round 3 of the revision. So, round 1, round 2, and round 3, it is a time when you recall all your PYQs of the INSET and NEET. So, this has been the recent NEET INSET exam question, repeat in your paper. And this is your workbook where we discuss about the fracture neck of the femur. We divide them as the intracapsular are two fractures, subcapital transcervical, and basic cervical, which is extracapsular, and ITs. After that, you can see this marking over just my head, this one. You can see this marking. So these three are the fracture, neck of the femur, and now this is your IT fracture, right? This is your subtrochanteric fracture. So we always discuss the intracapsular and the extracapsular fractures, right? So this is your IT. So another one, the image from your, the another one, the image from your workbook, right? So this is another page. Now this, so I'm so happy. If this was the image of your exam, which you all have told me, a patient presents with a ring-shaped lytic lesion in the bone, which is the following is the diagnosis. Now I'm 100% sure जिन बच्चों ने अपनी वर्कबुक को ओपन किया था, in the workbook you have the same picture. See this. In the workbook, you have the same picture. This is your chapter of infections, the chronic, acute, and subacute osteomyelitis, right? So, what image was that? This was the image of your Brodie's abscess, right? This was the same image that you had in the exam. So, this is your Brodie's abscess, and you know, Brodie's abscess is what kind of infection? It is a subacute osteomyelitis, right? So, IBQ image-based question, it is here. So, whatever we discuss in the class, you know that it has to be common things, commons are to be asked first. common are to be repeated number of time in your revisions, right? So another one, the subacute osteomyelitis. Okay, simple bone cyst, aneurysmal bone cyst, and osteoblastoma. You all know. Had it been osteoblastoma, it should have been a cortical lesion with lot of whiteness. Aneurysmal bone cyst or the unicameral bone cyst, they will come with the typical features as the central area, metaphyseal area of the bone. Fallen fragment sign, it will be simple bone cyst. Separated appearance, somewhat like a soap bubble, is your aneurysmal bone cyst, right? So same image in your exam from your workbook itself, the Brodie's abscess. Okay, that is your Brodie's abscess. All right. So next one was in your exam. The next one in your exam, it has been this one, right? A typical traditional question of all your exams. A patient presenting with the fracture shown in the X-ray. Which nerve is most likely to be injured in this type of fracture? So what kind of fracture is this? What kind of fracture is this? This is the fracture shaft of the humerus, right? This is the fracture shaft of the humerus, and you know very well that in the fracture shaft of humerus, which is the most commonest nerve involved, it is the radial nerve, right? Median nerve is involved as the in the maybe elbow area the injuries are there. The AMR you will learn the supracondylar fractures. Ulnar nerve can be involved as a tardial nerve palsy. Axillary nerve in the oh beta axillary सत्यम क्या बोल रहे हो इसमें axillary nerve is it axillary nerve shaft of humerus में axillary nerve is in proximal humerus यहाँ पे इधर is axillary यहाँ पे radial supracondylar can be median, right? And ulnar nerve, it is usually the tardy ulnar nerve palsy, right? And this is the image of your workbook. The radial nerve involved in the fracture shaft of the humerus, and this we always discuss. This page of the fracture shaft of humerus we always discuss with the peripheral nerve injury, the radial nerve injury. So, what kind of presentation will happen with what kind of injury at what levels? So, axillary injury leads to what? Spiral nerve injury leads to what? Shaft of humerus leads to what? So, you all can appreciate, right? What is crutch PLC? What is Saturday night PLC? Radial head involvement leading to Montegia, right? It is being involved in the Montegia fracture. Okay, so radial nerve. Satyam gadbad to nahi kiya hai, right? So it has to be the shaft of humerus involving this radial nerve. Now, at the end of the peripheral nerve injury topic, we always make a list at what level what all nerves can be involved, right? So which ligament is tested in the following test? Can you tell me now? Which ligament is being tested in the following test? You can see the knee is being bent almost at 90, right? And the examiner is trying to pull the leg anteriorly. What exactly the test is this one? Which test is this one? So you can very well appreciate that this test is anterior cruciate ligament test. This is the flexion of the knee at 90 degrees. This is the flexion of the knee at 90 degrees, right? Had it been pushing it back, it should have been the posterior cruciate ligament test. That is a posterior draw test, right? Anterior draw and posterior draw. Had it been the collateral injury, we know that collaterals are on the side. So they should have been a picture giving you sideways kind of pressure, valgus or varus kind of force, right? So either it is the anterior cruciate or the posterior cruciate, the anterior draw or the posterior draw, right? What image is this? When you are pulling it anteriorly, you are trying to check for what? You are trying to check from your workbook the similar picture. It is the anterior draw test. Same image from your workbook, right? It is your page number 33. So we are checking for anterior. By mistake written wrong here in the paper, it is right. Very good. Chal, theek hai. I agree to that. Very good. Very good. So this is your page number 33 from the workbook itself, right? So we are checking for anterior cruciate ligament injury. Okay. So remember, this was the image of the exam, kind of this, and this is your workbook image, page number 33, right? Then we have another one, and I'm 100% sure you will have, or you all would have marked it very accurately. A young adult patient, please catch the words, young adult, right? Presenting with the fracture of neck of the femur. What is the most appropriate management? And I'm very sure इसका answer सबने ठीक लगाया होगा by looking at this page of your workbook, the chapter of lower limb trauma, right? We have always discussed in the class कि ये तो एक question बनता ही है, यहाँ भी question, right? So this table itself is important. So when you have a patient more than 65 years of age, the preferred answer is replacement. लेकिन अगर patient 65 से कम है तो हमारा principle क्या होता है? Save the original head, isn't it? Save the original head. तो आपको save कैसे करना है? It depends upon what is the status of the head as of now, right? लेकिन बचाना तो उसी को है. सो इसीलिए हमें फिक्स करना है एज सुन एज पॉसिबल, राइट। सो अब यहाँ पे उन्होंने क्वेश्चन क्या पूछा, यंग एडल्ट नेक ऑफ फीमर क्या करना है, बचाना है कि रिप्लेस करना है, what is to be done, what is the ideal thing to be done. So you know very well that in the young adult with the fractured neck of the femur, the appropriate management is save the original head, right? The appropriate management has to be to save the original head, right? To save the original head. All right. So external fixation 9, replacement 9. This has to be done with the patient more than 65 years. This no, it is again wrong. So THR to be done, you have seen this. THR to be done if arthritis is present and it is totally replacement, right? So this is a flow chart of your workbook only. Okay, so here the best answer would be internal fixation. Fix it as soon as possible. Now, how to fix? It depends upon what kind of injury. If it is subcapital transcervical, go for CRIF, the cannulated cancellous screws. And if it is BC cervical, go for DHS, right? So, guys, these are the questions of your orthopedics. And actually, I am really so happy looking at the questions because I know you have read it very carefully. No mugging up, right? No unnecessary, recalling of the things in the wrong manner. You have learned the concepts, you have learned the basics, and I'm very happy looking at the paper that orthopedics was not at all tough for you. Okay, so all these 7, 8 questions that we have discussed, you all have marked them very, very accurately, right? So my only, this is the Instagram where you can have any doubts if you have in orthopedics, whether you are a student of DBMCI, you are not a student of DBMCI, feel free to put a message to me on the Instagram messenger, right? So other than that, we have little issue with our Telegram group. I don't know what has happened wrong there. So it is somehow not accessible to people. I don't know what has gone wrong. Okay, so meanwhile, you can WhatsApp is always crowded, so you can have the Instagram group. We have an orthopedic discussion group there. Just join that and just drop me a message, whatever you want to discuss with me, right? So again, my simple message to all of you is very, very clear. Stick to the basics, stick to the concept, stick to the commons, right? Don't try to learn too much from everywhere. Aim of any of your exam is to not ask that how much you know, right? They want to know that how much of the basics you know, how much of the concepts you know, right? This is like the whole idea. Okay. So, yeah, thank you so much, Rohini, for your kind words. But actually, I am so proud of all of you, those who have made me so happy, so happy that you all have done so wonderful with all these orthopedic questions, right? So, guys, now I'm just giving a message to all the students who are going to give for or appear for the December exam. बेटा सारे सब्जेक्ट पढ़ने हैं, all 19 पढ़ने हैं, all 19 के नोट्स खुद बनाने हैं, हर सब्जेक्ट के बाद एक टेस्ट देना है, टेस्ट के बाद फैकल्टी का रिकॉल जरूर सुनना है, 3 से 4 सब्जेक्ट होने के बाद यू हैव टू गिव द क्यूमुलेटिव टेस्ट, क्यूमुलेटिव टेस्ट देने के बाद अपना सब्जेक्ट वाइज एनालिसिस निकालना है दैट वेयर एम आई लैकिंग, in which subject I am lacking, in which topic I am lacking. So micromanagement is very, very necessary, right? After your 8, 9 subjects are done, make sure that you start giving grand test. Grand test का मतलब all 19. Yes, you are hearing me right. 9-10 सब्जेक्ट के बाद में मेक श्योर यू आर स्टार्टिंग गिविंग द टेस्ट ऑफ ऑल 19. एग्जाम में सिर्फ आपकी मेमोरी टेस्ट नहीं होती है, एग्जाम के अंदर आपके पेशेंस का भी टेस्ट होता है, एग्जाम के अंदर आपके माइंड की स्ट्रेंथ का टेस्ट होता है, दैट हाउ मच स्ट्रांग यू आर टू बेयर दैट प्रेशर ऑफ द एग्जाम एटमॉस्फेयर, राइट? सो अपनी प्रिपरेशन को, दिस इज व्हाट यू कॉल एज राउंड 1, राउंड 2, राउंड 3 आपके दिमाग में रेडी होने चाहिए कि जब सारे 19 कर लोगे तो रिवीजन कैसे करोगे, रिवीजन करने के बाद आईने सेट के और नीट के रिकॉल कैसे करोगे, एफएमजी के रिकॉल कैसे करोगे. सो प्लीज प्रिपेयर योर प्लान बिफोर हैंड. यू आर एनीवेयर, यू आर स्टडिंग एट होम, यू आर अ पार्ट ऑफ एनी ऑफ द इंस्टीट्यूट, वेर एवर यू आर, मेक श्योर कि आपके पास अपना प्लान रेडी है, राइट? सो इफ यू कैनॉट मेक अ प्लान, go to someone who can make the plan, right? And if you don't have any plan and you're still at home, please follow our plan. We have the plan and you can take it from my team, right? So just I'll be more than happy if I can help any one of you out in your preparation, right? And thank you so much for making me so proud that everything that you have read, every effort that you have put in, जितनी मेहनत की थी सारा का सारा, it has paid you back, right? So my heartiest best wishes to all of you for a wonderful result, and I'm hoping to hear from all of you, right? So all the very best, everyone, and see you all in the class, on the YouTube, on the Zoom, or on the Instagram channel, right? So always available for you. Just let me know wherever you need me, right? So thank you so much. Have a wonderful time.